Lisa Davis from the Geckel Nutrition Diabetes Center joining us today here on To Your Health. Lisa, you saw that spread out there, right, with the food and everything for
Yes, I did.
our audience that's joining us here today in studio for the first time. So you were talking about how it's a nice spread of vegetables and everything of nutritional value. But we all know, you and me, with the holiday season around the corner, that's not always the case with the holiday parties and also with the festivities that go along with it. And it's a challenge. We talked about this before our interview today, how for anyone, it's a challenge to eat healthy around the holidays and make sure you get your exercise in. But for those with diabetes, I'm sure it's even harder. So today on To Your Health, we'll be talking about healthy eating habits for people that have diabetes. So Lisa, let me ask you a quick question. What is diabetes? Can you tell us what that is, please?
Sure. Diabetes is a condition where your body doesn't properly process sugar to convert it to energy. The energy, or as glucose, builds up in your bloodstream, and you wind up with high levels of sugar that your body really can't utilize. So a key player is the hormone insulin, which is made by the pancreas. And the job of the insulin is to basically help get the glucose into your cells where it's then converted for energy and it becomes useful.
Now, we talked about earlier how there are different types of diabetes and risk factors associated with those types. Can you elaborate a little bit on each type of diabetes and what those risk factors are?
Sure. So there are 3 different types of diabetes. Type 1 occurs when your body can no longer make insulin, and it's typically diagnosed in young individuals, children. Because your body's not making insulin, you have to inject insulin in order to be able to live. So it's a very serious condition. Type 2 is more common. With type 2 diabetes, you actually do make insulin. However, it doesn't work properly. It often occurs in individuals who are overweight, older, have a sedentary lifestyle, maybe have put on a few pounds over the years. And their insulin is there, but they can enhance the way it works if they lose some weight, if they make some dietary adjustments by cutting out some of the high sugar foods, also by adding some exercise, which can help with both the utilization of the sugar as well as with the weight loss. So that's the second. It's more common, as I mentioned. It's also becoming more prevalent, type 2, in young adults who are overweight and have had kind of developed a lifestyle that is more sedentary. So it's showing up more and more frequently in some of our young people. The third type is actually called gestational diabetes, and it occurs in some women who are pregnant. The hormones during pregnancy create some insulin resistance, so their bodies have to crank out a little bit more insulin. And so that extra insulin helps to keep blood sugars under control. In some cases, women need to follow carb-controlled diets to be able to minimize the buildup of sugar in their bloodstream, and that works very well. In some cases, insulin injections are necessary, but in a lot of cases, diet works well.
So basically the take-home message for each one is pretty much watching what you eat, the diet, and getting your levels checked. Right?
Correct,
Okay.
yes.
Joining us today on To Your Health is Lisa Davis. She's a registered and licensed dietitian with the GBMC Geckel's Nutrition and Diabetes Center. Did I get that right?
Correct.
All right,
yes.
There we go. See, I was having a little problem with that earlier before we started the show. I want to encourage everyone who's watching us on Facebook and our live in-studio audience that if you have any questions, please send them in on our private message or on our Facebook page. And for the in-studio audience, please, if you have a question, raise your hand, and we will get the lovely Samantha to come on over and give you a mic, and you can ask any question you want of Lisa Davis, registered and licensed nutritionist and dietitian, right, with the Geckel's Diabetes and Nutrition Center. We're going to go a little bit over the map. We're going to talk about holiday food prep. We're going to talk about holiday eating. We're also going to talk about checking those glucose levels and stuff. And we're going to try to get to all that, within the time that we're allotted. So let's talk about holiday food prepping, okay? Making that meal. Not just making that meal if you're someone who's going to a family or a friend's house, or someone who might be hosting family or friends at their house during the holiday season. So for people that have diabetes, okay, what should they keep in mind when they're preparing that holiday meal? What are a couple rules of the thumb, as they say, for people to remember?
Sure, John. So a few rules of thumb when you're planning a holiday meal. First of all, you want to think about balance, and you want to make sure that you've got a lot of different sections of the plate covered. One of the key things when you're planning a meal is to make sure you have some protein, which is a satisfying component of the meal. Secondly, you want a lot of volume from vegetables that are not starchy. And then lastly, you want to make sure you have some sort of starch, which preferably is whole grain. That's pretty much the carbohydrate content of the plate. So you want to make sure you have balance. If you're looking at appetizers, and you're thinking you've got some carbohydrates at the main meal, you don't want to overload your guests with appetizers that are high in carbohydrate. So my suggestion would be to use some appetizers that are maybe lean proteins, such as shrimp that might have a cocktail sauce to go with it, or some of the raw vegetables, I think you call them crudités, which go with hummus, perhaps a dip which might be made from Greek yogurt, which has got a nice amount of protein. So those are all examples of very low carb appetizers. So this way your guests don't feel like they can indulge in some of the carbohydrates that might be present at the meal. Bread products, which are high in carbohydrate, oftentimes can be a big part of holiday dinner meals. So if you're planning to have stuffing and mashed potatoes and sweet potatoes, you want to make sure that you're not really overloading your table with biscuits and bread and all of those other additional carbohydrates that are kind of like everyday foods. I'd rather have you kind of focus on the special carbohydrate foods that go with the holiday menu.
So Lisa, you talked about appetizers, but for people with diabetes, can you give me some good examples of a main meal or a dessert or even drinks, especially drinks around the holidays that are, I don't want to say, but diabetic friendly, you know what I mean? For
sure.
people that have diabetes or might have a friend or a loved one that has it. Can you give us some examples of those?
So I guess we'll start with drinks first, since you kind of, emphasize that. So drinks that are alcoholic have the potential to lower blood sugar. They all also have the potential to be high calorie if alcohol is mixed with a sugary mixer like soda or juice. So the key with alcoholic beverages is you can have a drink, but you want to pair it with food, and you want to be sensible and limit yourself to one or two. You should drink beverages primarily that are sugar-free or unsweetened, so tea, herbal teas, water. No, that's not exciting, but some people like to put fruit in it. They create what's called infused water. So citrus fruits, berries, makes it look pretty. You can also put berries in ice cubes and kind of float those in water. So in the end, it's still water, but at least it looks pretty. As far as desserts, some of the more diabetes-friendly desserts are those which are not so sugary, so don't have a lot of added sugar. I'm thinking of a baked apple, maybe with some cinnamon, a little bit of nuts, maybe a bowl of berries that's got a hit of really nice whipped cream on top, and maybe even chocolate sprinkles. I think that the presentation of something simple makes it more desirable because you actually look at it and you're thinking, wow, this looks good. I'm sure it's going to taste good. So that's a key to try and help dress up some ordinary foods that are a little bit healthier for us and can result in a not so high a blood sugar after that particular meal.
Well, a lot of good information there. We're going to come back to the prep part. We're also going to attack, like I said, eating and checking blood sugar levels.
Sure.
Again, joining us today on To Your Health is Lisa Davis, registered and licensed dietitian with the Geckels Diabetes and Nutrition Center over at GBMC. Again, I want to encourage you, those watching on Facebook, at home or at work, and it's okay if you're watching at work, it is lunchtime, so that's not a problem. And our audience members, if you have any questions, please raise your hand and we'll be getting to your question as soon as possible. We do have a question that came on via Facebook, and Carol asked on Facebook, can you discuss LADA, diabetes 1.5?
Okay, I could address that. I don't want to get detailed, but it stands for latent autoimmune diabetes in adults, okay? So we talked about type 1, which happens more likely in children or young individuals. We talked about type 2, which happens more likely in old individuals who are overweight. LADA, as it's called, occurs in probably the thin adult, who it's disguised sometimes as type 2, but then it basically presents a little differently, and it becomes what's known as more like type 1. It has symptoms similar to type 1, where you require insulin injections, and that's key to helping control blood sugar. So it is between type 1 and 2. It may present typically as type 2 traditionally, but it ends up being a little bit more like type 1.
All right.
It's a challenging diagnosis to come up with, too.
Sure. And Carol, I appreciate you providing us with that question via Facebook. Eating healthy during the holidays, all right? What are some key strategies for eating healthy around the holidays? Some people say, you know what, it's a good idea to bring some snacks or snack a little bit before you go to that party or that holiday party at work, or even a party at a friend or family's house. What are some of the other tips? Can you provide that?
Great. Yeah. So, John, the main thing I want to kind of point out, one of the questions or one of the suggestions you made was to eat something before you go to a party or event. You know that if you are on an empty stomach, your food choices and your willpower is not really so strong. So I feel as though if you have something that's going to be balanced prior to going to a friend's home for a party or a holiday dinner, so balance is key in that you should have something that's got protein, which is going to satisfy you for a few hours. And you also should have something which is going to give you some quick energy. So, for example, a piece of fresh fruit paired with a little Baby Bell cheese or perhaps a string cheese. Another example might be to have something simple like a half a sandwich. Nothing that's going to basically give you the calories you would get in a meal, but something to curb your appetite and hold you over. So the first thing on your mind when you walk in that door is food. You want to be able to enjoy yourself, pace yourself, but have something that's going to tide you over for at least an hour or two.
One of the other strategies that doing research for today's program, I heard was carbohydrate counting and the plate method.
Okay.
Can you talk, what is the benefits of either one or both of them?
Sure.
Can you elaborate on that a little bit?
So John asked about the plate method versus carb counting. So some people find it much easier to just use the plate as a way of determining what their selection of food choices will be and what the portion sizes are. So I mentioned a little bit about the plate earlier. Half of the plate should be filled with vegetables that are not starchy. These have a lot of volume, they have very low calories, they fill you up, but they don't have much in the way of raising blood sugar. The other half of the plate should be divided into protein and starch. So if you follow that guideline, in essence, you are controlling carbohydrates. Some people like to specifically count carbs, and it may be necessary if they are on a particular medication regimen, such as dosing insulin based on how many carbs they consume. So typically, about 45 grams of carbohydrate would be roughly what would be sensible. It's a little bit on the controlled side, but 45 to 60 grams is a good ballpark to aim for when you are going to be carb counting. Now, when you think about the plate, the main source of carbohydrates on the plate is the starch. So if you decide to have 3 servings of starch and a quarter of your plate with a sensible portion size, let's say a half a cup, is about 15 grams of carbohydrate. So if you triple that portion size, that's meeting your 45-gram allowance of carbohydrates that you've allocated for yourself for that particular meal. A piece of fruit, remember the berries I talked about earlier, could serve as the final 15-gram carb choice. So that would total up to 45 on the plate, 15 as the extra, on the side as a dessert. So the total for that meal would be 60 grams.
Nice job. Good information. Thanks, Lisa.
Sure.
Again, if you have any questions, please feel free to post them on our Facebook page, either in the comment section or a private message. You can do that. Lisa, quick question. If someone is interested in finding out more about the Geckels Diabetes Center, what's the best way to get in contact with you or the center itself?
You can go to our website. Our website has the information that you would need to be able to give us a call and make an appointment. As you can see, the website is right up there on the screen behind me. We are a education center, so our focus is in helping to give you the tools and the strategies that you need to take good care of yourself with diabetes, so that even during the holiday season, where stress and maybe less time for activity and maybe a little bit of overeating comes into the picture, hopefully we can give you some strategies that will keep you going with the minimal need to worry about whether or not your blood sugar is going to be out of the targets.
Lisa, we talked about healthy eating, planning. Let's talk about checking your blood levels and also eating. So my big question is, it's the holiday season, right?
Right.
Some of us get in a car, some of us get in a bus, train, plane, to go see family or friends across the country. And a lot of times, like I know when I'm on a plane, some of the food that is provided by the airlines isn't, well, first of all, it's not very healthy in the first place, just for ordinary folks, but for people that are dealing with diabetes. What are some of the tips you can give to people, not just eating, but also keeping their blood sugar levels in check when they travel? Because a lot of us are going to be traveling during the holiday season.
Correct. Well, there's a couple questions that you had asked, and I want to kind of first address. When you are traveling, you want to make sure, and a lot of people don't think about this, make sure you take your blood glucose monitor and make sure you take your supplies and keep it in your carry-on, okay, so that at least you have that available and you don't forget. Secondly, think about how long the distance is. If you're going to be flying on that plane for several hours, you may need to actually pack a sandwich or bring something in your carry-on that you're going to be able to have that's balanced, carb and protein. It could be a sandwich and a piece of fruit. They always give you beverages on the flight. You can choose sparkling water or a diet soft drink or just plain water. As far as checking your blood sugar when you are during the holiday season, I don't know if you know the goals, but when you are checking your blood sugar before a meal, so if you were to wake up in the morning and your plan was to check your blood sugar before breakfast, you want your number on the little meter to fall in the range of 80 to 130. Once you've eaten a meal, your blood sugar does go up. Your body goes ahead and actually insulin comes to the rescue and starts to lower your blood sugar. After 2 hours from the time you've started eating, your blood sugar should fall below 180, okay? That's milligrams per deciliter. Those are the same kinds of guidelines and the same targets you would follow if you were out and about. One of the things that can raise blood sugar is stress. So the stress of travel can be something that you didn't plan for, but activity can help lower blood sugar as well as relaxation. So, the activity can help relax you and help you lower your blood sugar. It can also help to de-stress you. So positive things with activity there.
We got a few more minutes left in our program,
Sure.
but we do have some audience questions, so I want to get to those before we close for the day. Samantha?
I'm going to read one here. What are some of the more recent advances in diabetic care over the past 5 years or so?
All right, so a lot is happening in the world of technology. So as far as people who have diabetes, there are now continuous glucose monitors. So for people who are especially challenged by blood sugars not really getting into the targets regardless of what they do, continuous glucose monitor is a device that you wear that tracks not necessarily blood glucose from your blood, but it actually captures interstitial fluid, which also can give an example of what your blood sugars are. And it can help your doctor determine whether or not your medication regimen is needing adjustment or whether something else is in the picture. So that's one. Also, meters are so chic and sophisticated. You know, they can be carted around with you, not be so bulky. So that's not necessarily new. There's a lot of foods, I think, on the market that are more friendly when it comes to diabetes friendly because they're healthier for us. So they may not be as high in sugar. I just think there's more options when it comes to food. So technology, the meter, which is part of the technology, new medications for sure. There's always new medications popping up on the market too. So diabetes is a chronic disease. If you don't have good control with one medication, it's possible that a different medication could give you better control. So don't forget to ask the questions when you're with your doctor as far as, are there other medications that can perhaps help give me the kind of control we need?
Thanks. We had 2 more questions from our audience.
This is Garrett.
Hi, Lisa and John. Thank you for sharing your insights with us today.
Appreciate
My
you being here,
question is about food choices, and you talk about the new options. Food labels have come a long way, but I think they can still be confusing. What should we be looking at as we try to make those healthy choices? Is it carbohydrate? Is it low fat? Is it protein? Is it gluten-free?
Okay. Garrett, that is a good question, and it is confusing when you look at a nutrition label. So I always, again, like to keep it simple when it comes to looking for, what's important in the nutrition label. First of all, you want to definitely look at the serving size. I think that sometimes we lose sight with what is a serving. A serving size might be a half a bag when we look at something, for example, a bag of chips that might be a 2-ounce bag. That actually has 2 servings in it. So you want to look at the serving size. Secondly, if you are carb counting, the carbohydrate content is very important. So 15 grams is a standard serving when it comes to carbohydrates. So 15 is an important number to remember. Directly underneath the carbohydrates, you'll see fiber and you'll see sugar. Fiber is important. Fiber slows down the digestion of that food. So you want to have a food that has fiber. You also, sugar is important, but foods that have added sugar are always going to have more carbohydrates as well. So if you're counting carbs and you're looking at the food label, look at the carbs and not necessarily the sugar. Garrett asked about gluten. Well, that's a little bit of a different question. Anything that has gluten in it is going to pretty much be indicated on the label. So you want to make sure it says gluten-free. And I can't remember what else did you say, Garrett? There was one other, I think it was fat grams. So as far as fat is concerned, a good rule of thumb is to make sure that the fat in the food you're choosing is less than 1/3 of the total calories. So a little bit of math calculating, but the fat should be less than 1/3 of the calories. So a couple grams of fat. If it's a snack, for example, 4 grams of fat or less per serving would be reasonable.
We have one more question from our audience.
Yes, here it is. Are the newer non-invasive glucometers considered to be an accurate reflection of blood sugar levels?
Good question.
All right, so you always need a blood sample to get a blood glucose reading. So I think that there are options to check your blood sugar without using your fingertip, but you still always need a small sample of blood. Some of the meters have strip technology that requires the smallest drop possible. So you want to make sure that, if you are having a problem getting a big sample of blood, you choose a meter that's going to require a minute sample. Some people don't realize you can use your forearm to check a sample of blood, or you can use the palm of your hand. The fingertip is recommended first and foremost. So, but also if you're injecting, rather than not injecting, if you're sticking yourself with a needle, you want to make sure that you are using a low setting. We don't need to push too deep into your skin to get a sample. So that's important as well. Those are just a few factors. Just to kind of give you Your diabetes educator can also help guide you in making a meter selection. So if you're having a decision about which meter is best for you, check with your diabetes educator. They can help guide you in that decision.
All right, Lisa, we got about 2 more minutes left in our program. So we talked earlier, a lot of times when people find out that they have diabetes, they look at it, they get upset, they get sad. They're like, how can I have it? I mean, I try to follow a good diet, I exercise, so forth and so on. What are your words of encouragement to those when they find out that they have diabetes?
Well, you can change certain things in your life which can improve blood sugar control, but you can't change your genetics. So if you have a family member who has diabetes, that's something you can't change, so you have to kind of shrug it off. But as far as diabetes, a healthy lifestyle, which means healthy eating, regular activity, not only is it helping you with diabetes control, but it also helps with keeping your heart healthy. As we age, our bodies are aging. Something might break down or go wrong as we get older. So making sure that you eat healthy and you stay active, you keep your weight down, it's going to help improve your blood sugars if you have diabetes. Diabetes is something that is very manageable. If you have tools and strategies that will help to guide you and keep your blood sugars in check, that's going to really create a healthy life for you, a very good quality of living. Ask your diabetes educator, consult us to help you make some good changes so that you can lead your best life possible with diabetes.
This is Lisa Davis, licensed and registered dietitian with GBMC's Geckel Nutrition and Diabetes Center. Lisa, thank you very much for being here today and providing all of us, both at home and at work and here in our studio, with great information. I appreciate you taking the time to join us today. And I want to thank, a special thanks to everyone at home or at work who joined us on Facebook and the audience here that joined us today. I want to especially thank, I got to do this, my family, my wife, my moms, and my dad who came out here today to lend support to this program that for the first time had a live in-studio audience. Join us next time here on To Your Health. Our next program, we're actually going to talk about winter health and safety tips, right? We know the winter season is right around the corner. What are certain things we can do to prepare for the winter months, right? So joining us will be the chairman of the Department of Emergency Medicine at GBMC, Dr. Jeffrey Sternlick. But again, that's going to be on Wednesday, December 13th at 12:30 here on To Your Health on GBMC's Facebook Live page. Again, thank you all for coming here today, and until the next time, here's to your health. Cheers.